everybody, this is Azar, physical therapist. Today we want to talk about the subject that you probably didn't hear that physical therapists can treat. Yes, vertigo or dizziness. That's the subject that sometimes your doctor, when they see that you have dizziness or vertigo, they're gonna tell you that you can see physical therapist, and you amazingly think that, wow, how come the physical therapist can help with dizziness? Yes, that's correct. Some kind of dizziness and vertigo, the physical therapist can help. And I'm going to tell you how you can understand what kind of vertigo the physical therapist can help you, and how you can get help from physical therapy for your vertigo. First thing is you have to figure out exactly why your vertigo started, and is that any cause, like a physical cause that could cause it potentially, or is something internally that you have to see your ENT doctor or your neurologist or other people. First thing first, you have to see if that is positional vertigo, if it's depending on the position. What does it mean? Positional vertigo is when you move especially your head in a certain direction, you start getting the vertigo. So for example, if you move it fast, your head to this direction or that direction, you're gonna start having vertigo. Or if you move the head down or you move your head back up, then you're going to have vertigo. These kind of positional vertigos are related most likely to the physical therapist, and they can help you with their techniques. So some of the vertigos are from the trauma. Sometimes you can fall and you can develop vertigo. How the fall can cause vertigo? Yes, don't think that you should just have a brain damage or TBI or some kind of traumatic brain injury to have a vertigo. You can just have some very simple issues happening on the inner ear, which is the gelatinous stuff inside the inner ear, which we call them crystals. They can get a little bit displaced, means that the gelatinous area inside your ventricle or suckle or the semicircular ducts of the inner ear, they are filled out of the gelatinous material, and these gelatinous materials, they are attached with the hair cells. And when you move your hair, that hair cells start moving, and then they move that gelatinous stuff with them, and then this message will go to your brain saying that, oh, I have a head movement. And then you're gonna see like a head movement, you're gonna feel like a head movement, and then that's a correct feeling. But sometimes you get an incorrect feeling of a head movement. You actually don't even move your head really fast or really bad or anything like that, which is not gonna cause dizziness, but your hair cells constantly get stimulated by the gelatinous material, which is probably not in shape, and then that hair cells start keep getting stimulated, and you imagine that you're in the boat. You think that you're in the roller coaster, but you're actually not. You just simply move your head a little bit, like to different directions, to do your activity, daily living. You're not in the roller coaster, you're not in the boat, but you feel like you are, and you start getting the dizziness. That kind of dizziness, we call it vestibular issue dizziness. So this kind of dizziness or vertigo are related to the vestibular issue, meaning that your inner ear material is not intact anymore because of maybe trauma, maybe ear infection, or sometimes there's like you don't even know, you don't even have a reason for it. The material in the inner ear just got a little bit, how do you call it, disconnected from each other. It's not like a unique gelatinous anymore, which only the hair cell can get stimulated really bad with being on the roller coaster or going to the Six Flags. You just in the real or regular stuff that you do daily, you're gonna feel like you're in the roller coaster, and that's very terrible, very annoying. So you're gonna start getting very bad dizziness with every single movement of the head. I'm gonna show you the picture of that semicircular ducts and the ventricle suckle and the gelatinous material. Hopefully you can see that in this picture. These semicircular are filled up with that gelatinous area, as you can see. These are semicirculars. and these are utricle and suckle. This is inside of your inner ear, and they're all filled up with that gelatinous material, and the hair cells are around them. Some crystal can happen inside. We call them crystals, but it's meaning that is kind of the disconnected material of the gelatinous, which can cause constant hair cell stimulation. And that's when you get dizziness. So how you can find out if that dizziness is from inner ear? First thing, as I said, in the history, if you have any history of the ear, infection of the ear or other stuff, or trauma or something on your head, or very jolt movement on the, even not trauma, just jolt movement of the ear, which can get gelatinous material to get disconnected. And hopefully this gelatinous material can come back with the physical therapy maneuvers, which we're going to go over hopefully in the next video. The second thing that we have to ask the patient, we have to ask, is it positional? So if it's really depending on the moving the head, yes, that's something that we can treat hopefully in physical therapy. But if it's not related to moving the head, if you get a certain food and get dizzy, that's probably not vestibular dizziness. Maybe your blood pressure changes with different food, and then different message go to your brain, and then sometimes some people, when they get up really fast, even without moving their head, they start getting dizziness, especially older people. In that case, is not a vestibular issue. It's usually we call it orthostatic hypotension. Means that their blood pressure goes down when they get up fast. Usually in the people that they take medication, it happens. Blood pressure medication. Sometimes when they get overdosed in the blood pressure medication, when their blood pressure is actually not too high because the good food that they ate, and they get blood pressure medication on top of it, like daily dose, and then they start having that orthostatic hypotension, so the blood pressure drops, and then they get dizzy when they get up fast from the bed. Very, very likely happens, and you probably have seen in your grandmas and your people around you. They are older people, they definitely have that, most of them. That we cannot help much in physical therapy, but the positional one we can. Some of the positional ones are actually not the position of the head by itself, sometimes the position of the eye. These are the visual vestibular. We can also treat them too in a certain way, but not with the maneuvers, but we can train the head and the eyes to get habituated to these movements, fast movement. This vestibular, the example of the visual vestibular is when you're sitting in the car, and some people can really read and do their assignments, homeworks while in the car, but some other people get nausea, get this dizziness, they can't read, they can't do anything while the car is moving. So that's something that it's your vestibular system. Again, that's a visual vestibular. So if you probably close your eyes, you feel better. If you ask people to close their eyes if they have this issue, they said, oh, my dizziness is going away. Yes, because that eye movement cannot get adapted. So, but it's the same kind of nerve, the cranial nerve number 8, which is the vestibular nerve. It goes goes hand in hand with the hearing nerve. That's the cochleovestibular issue, basically cranial nerve number 8. That's responsible to bringing the message of the vestibular balance and hearing to the brain. Some people have Meniere's disease. This is the disease that they can affect the inner ear for people. It's very vague disease. People get tinnitus in their ear. They feel like they are in the boat all the time. This doesn't have a good prognosis. Sometimes physical therapists cannot help with that kind of vertigo. It hopefully can go away with medication or some kind of other things that the other specialists they can do. But let's do some testing for vestibular, how we can know if the vestibular system involved and the physical therapist can help. So first thing is you're going to put your finger there, and then you have the patient look at your finger actually, and then you're going to bring your finger side to side and have them look at your finger. Most likely if they have visual vestibular, they might get a little dizzy. But it's not as bad as if they move their head with it, which that's going to be what? That's going to be the head movement. Actually, that inner ear crystals can move, and the hair cell can get really bad stimulation, and then they can get really dizzy or even nausea. Another thing is like to have them look at your finger while they go into different direction, but looking at different direction. That's even more confusing. So that can be really causing dizziness for people if they have a vestibular issue. It's good for you to look at their eye movement while they're pursuing something, or they are like just with the eyes looking at something. Make sure that's a smooth movement. If it's not a smooth movement, that's something else. Could be even like brain damage or something very more serious. So, but if they are okay with like pursuing or like looking at your finger without using the head, they most likely are okay. At least you know that they don't have a brain problem. But if they have problems with moving the head, like vertigo and stuff, but no problem with moving only the eyes, that's a better prognosis. Usually the physical therapy can help with habituation. You can simply give them all this test as a treatment. So have them look at this and then move their head, and that's going to be a very good treatment for them. They get nausea, they get like dizziness first, but you're going to keep doing it and make them habituated to that motion. Another thing is you can grab a paper that has some writing on it. That's a good test for visual vestibular. Have them move their head. First have them look at the, make sure they can read. They can read that like a chart, like a visual chart. And they're gonna start reading for you. Or then you tell them that, okay, move your head and read the next line for me. And move your head fast, side to side. If they can, without movement of the head, they can read it very good. But with the movement of the head, they start getting dizzy and they can't read. Yes, that's positive test for visual vestibular problem. So that's another thing that we're gonna pay attention to. Now we wanna test some with some maneuvers, test some of the actual vestibular issues like in the crystals. The first position would be you're gonna have them bring the head backwards and sideways. So first backwards, extension and sideways. If they have a neck problem, they already might have dizziness. That's another problem, because the neck can cause dizziness too, which I'm gonna tell you after this video. So this is the one position, and you want to have them lay down with that position, exactly with that position, and look like that. If they get dizzy this way, then they probably have vestibular issue. Okay, and have them get up. You're testing the left ear now. And now we're going to test the right ear. Have you go to the right and backwards. And again, you're going to have them lay down in that same position and come back. If they get dizzy with having the head extended and to the side and lay down, they're positive in the vestibular test. So you want to test that way, okay? We call that test Dix-Hallpike maneuver, very famous test with physical therapists. And if they're positive on that, they better go to the physical therapy places to get treatment. Now you're familiar with all the physical therapy, vertigo problems that physical therapy can help. And hopefully in the next sessions we can go over more stuff that can cause dizziness and physical therapists can treat. If you have any of these issues, please go to the doctors, either ENT, neurologist or primary doctor, and have you referred to the physical therapist. We have maneuvers to help you get fixed, but make sure that first of all, ask your doctor to make sure physical therapy is the right option for you. As I said, not all the vertigo and not all the dizzinesses are caused by the problems that the physical therapist can help you with. Thank you so much for watching the video. If you like the videos, please subscribe. And if you have any question, please don't hesitate to put it in the comment section, and I will definitely be more than happy to answer your questions. Thank you so much and have a great day.